So I just want to take a moment to welcome everybody to today's community conversation. And we're so thrilled as the DEI cabinet and programming committee to collaborate with LMSA to bring this to you to celebrate Hispanic Latinx Heritage Month. LMSA is sponsoring today's event, so they will be facilitating the discussion. And I'd like to introduce you to David Brown. He is a second-year medical student here at KUMC, and he's the secretary of LMSA. Kyle, I'm going to butcher your last name, I'm so sorry. Kyle Rempestritzer is a second-year medical student at KUMC, and he's the co-president of LMSA. Kyle, can you tell us how to pronounce your last name? I'm so sorry.
All good. It's Rampestrider.
Rampestrider. Okay, thank you.
All right, well, good afternoon, everyone, and thank you all for taking time out of your lunch hour to join us. Kyle and I, as well as the rest of the LMSA board, wanted to have a topic for this community conversation that is just so important in this time with the COVID-19 pandemic, and as well as with the community within Wyandotte County. And so I don't have much to say myself, but I get the pleasure to introduce three of probably the most knowledgeable people among this topic, three people who have worked together and are also here at KU Med to speak on how COVID-19 has affected the Hispanic and Latino population. So our three presenters, we have Dr. Alan Greiner, who is the Nason Family Endowed Professor and Vice Chair here at the University of Kansas Medical Center. He's a Department of Family Med and Community Health. He's also the component core lead for Community and Collaboration, Frontiers Clinical and Translational Science Institute, as well as the health officer for the Wyandotte County, Kansas City, Kansas Public Health Department. We have Mariana Ramírez, who's the director of Juntos Center for Advancing Latino Health, which is a part of the Department of Population Health at the University of Kansas Medical Center, as well as Dr. Erin Corvo, an assistant professor in the Department of Family Medicine here at University of Kansas. And she is also the director of the Division of Undergraduate Medical Education and the assistant director of the School of Medicine's Major Learning Society. So without further ado, I'd like to hand over this presentation to our three presenters.
Thank you, Kyle. Appreciate the invitation, and LMSA along with diversity and inclusion programming. Thank you, Kim, as well. Alexa, will you kindly help us with the PowerPoint slides? Thank you.
Great, and I'll jump in here again. Alan Greiner, Dr. Corvo and I are here at the Wyandotte County Health Department. We've been hanging out a lot here the last 6 months and working very closely with Mariana and a lot of other community partners to try to do what we can to mitigate the spread of COVID and try to limit its impact on some of the community segments that have historically had a lot of health disparities here in Wyandotte County. I imagine almost everybody on the call knows that Wyandotte County sort of sits in it's where the med center is, right? But it's sort of the northwestern kind of quadrant of the city, and is adjacent to, both Kansas City, Missouri to the east, as well as Johnson County, Kansas to the south. It's always been, or at least for many decades now, a very diverse community. I'm going to present some data on the community and on COVID, and then I'll talk a little bit about some of the reasons we think that we're seeing such an impact on the Latinx community. And then Dr. Corvo is going to go into a few of the things we've been trying to do to address needs and health-related issues in that community. And then Mariana will do the same and talk about some of the innovative things that have been going on with the kind of group of energized community partners. So Alexa, you can go to the next slide. So just to give a little framework on the population here in Wyandotte. So we've got Wyandotte over to the far right. We're not a huge county here, only 165, approximately 1,000 people, but very diverse. There are a lot of Hispanic Latinos here. It varies slightly depending on whose numbers you look at. We like to talk about a 29% Hispanic population here in Wyandotte. That's quite a bit more than the United States as a whole, and quite a bit more than Kansas, although, as many of you are aware, things are changing very rapidly with this population across the United States and across our region. Next slide. So what's going on with COVID cases? We continue to see a pretty steady number of cases. In fact, we're seeing a slight increase the last few days or week around here. We're at a lower level than we were at our peak during July, but continuing to have a lot of cases. Very heavily impacted in the Hispanic Latino community. You can see that 45% of the cases that have been detected in Wyandotte County are amongst that group. And like I said before, they only represent 29% of the population. So it's a disproportionate impact that we're seeing here. Next slide. In terms of deaths, we're actually not seeing quite as much of a disproportionate impact among the Latinx community. We're actually seeing more of a disproportionate impact in the African American community, which I don't show that data, but we are seeing quite a few, and we don't know what the future holds in this regard. We know, and I'll talk about this a little bit later, we know that the Latinx community here in our region and really across the United States is a younger age demographic overall, and there aren't as many older adults in that population. Otherwise, I imagine we would see a pretty disproportionate share of deaths among the population. Next slide. For hospitalizations, we are seeing quite a few hospitalizations. And again, we see over on the far right, you see we've got about 38% of the hospitalizations that have occurred in our county that are in the Hispanic Latinx community. So that's higher than that 29% that they represent. We don't have great data from all across the Kansas City metropolitan region on this, but we've been able to track pretty well what's going on in Wyandotte County because we only have 2 hospitals here. We have KU Hospital, and then we have Providence Medical Center out on the western side of the county. It's great that we're not seeing as many deaths, but this is something that we think is going to be a long-term burden on this community. Many of you have probably read and heard about. There's a lot of thinking that there are significant long-term health effects related to COVID, especially for people who get hospitalized. There are people who have really debilitating symptoms for months and months and months. We don't know yet how long-term those things will be. We do know that people can have cardiac conditions that seem to be long-term and sustained. So this is really worrisome. On top of the other health inequities we already see in our Hispanic Latino population, this is worrisome to us. Next slide. So what's going on with testing? And I think Mariana will talk a little bit more specifically about our pop-up testing activities, because those pop-up tests have really targeted the Latinx community. But we've been able to test quite a few. We're not doing as well overall with the overall testing. So these numbers are how many total tests have been done in Wyandotte County since the beginning of the pandemic. And we're approaching 40,000. And about 16% of those are in Hispanics, Latinos. We'd like to see that higher. Again, we'd like to see that at 29%. And because we know there's a lot of cases in the Latinx community, their percent positivity rate when they do test is very, very high. So for example, Mariana could probably talk about some of the pop-up events where literally we did 80 or 100 tests, and half of those tests came back positive. So folks in the community have been relatively good about coming and wanting to get testing, although we feel like in the last maybe month, 6 weeks, we have had a little bit of a downturn in demand for testing. We may have that reversed here in the last week, we don't know, but But we worry that the reason for that downturn is that people have kind of figured out after a while that it wasn't that beneficial for them to get tested. If they got tested and they're positive, they're going to get told they have to stay home from work, and they're going to have to tell everybody they've had close contact with to quarantine for 14 days. Major disruptions in people's lives, and especially for people living paycheck to paycheck who don't have sick leave or the kind of benefits that would allow them to bounce back from taking time off. This can be a problem. So we're going to have more work to do on that in the coming months. Next slide. So for cases that we interview, this is data from our contact tracing activity. So when we get a positive case that comes in our electronic system, because the labs all report to the state lab, and things get in the electronic system within hours, and we've got that data, then we start making phone calls to people. We're not finished completely analyzing this data, but we're trying to figure out what percentage of people we're actually reaching on the phone, what percentage are giving us all of their contacts, and eventually we'd like to know how many of those contacts are getting tested as well. You can see here that overall, the numbers of Hispanic cases that we've interviewed that are associated with outbreaks is lower than in the non-Hispanic group. That's actually a good thing. We have been very concerned that people are getting a lot of exposure in workplaces where they have to work close together, where maybe they aren't having as much protections in place in some workplaces as others, and that a population like our Latinx community might be sort of discriminated against and have less protections. We've had some pretty significant work outbreaks in the county, probably at this point at least 50 or so. Some of those where we get anywhere from 30 to 60 cases in a single work site or in a single nursing home, those kind of things. The good thing though is so far anyway, we're not seeing quite as many outbreak cases in the Latinx community as in the other community sectors. Next slide. We're also, when we make these phone calls, we ask people about needs that they may have from a social, economic perspective, and then we can refer them to community health workers. So when it says CHW here, that means community health worker. Dr. Corvo will talk a little bit more about this in a minute, but we've seen a lot of families report social needs, and a lot of families that needed food deliveries or other household supplies because they were going to have to go into quarantine. And there's been a group of nonprofits working on that in the county, and I think very successfully, including the Community Health Council here in Wyandotte County, Cross Lines, which is providing a lot of food delivery assistance, as well as these community health workers. Next slide. Here's just a breakdown on some of the things that the community health workers get involved with when they contact these families. Again, food assistance is really at the top. Issues with utilities. We don't talk, there's not quite as much about jobs and employment, although it seemed like in the early days there was a lot of that going on. Yeah, there's 15 under unemployment.
So for you guys, the asterisks are actually, indicate services that are actually more difficult to help families with if they are undocumented. And so many of our community health workers especially are working with family on the food delivery and issues with just, keeping up with the needs of their family in terms of nutrition and support and stuff like that, especially when families can't go out. We don't want them shopping if they've got positive cases within the home or they need to isolate or quarantine. But even so, there are some organizations that can help just with monetary support and stuff for some of these things. We have one community health worker. Her name is Guadalupe Treadway, who speaks Spanish. She's awesome. She also works at KU. So for those of you guys who come through the family medicine department, you may see her. She works with us in the interprofessional clinic as well, but she's been spending a lot of her time over here at the health department, and happily we've hired another Spanish-speaking community health worker as well. And then we have one that speaks Burmese and another that speaks Swahili. And so I think, you know, Dr. Greiner and I talk about what would you do if you had, you know, a couple $1 million, you know, at the project on sort of how to increase health and well-being in Wyandotte County. And I think I would invest in community health workers. I think Dr. Greiner might invest in community health workers as well, because, you know, these people are truly the linkage, you know, to services in the community, and the skills that are needed, I think, and language skills, person skills, that sort of stuff. It seems simple, but I tell you what, when you get a skilled CHW, you're really like cooking with gas. It's a big deal. So we've been lucky to have that. Next slide. Mariana, do you want to talk about these coming slides here?
Sure, yeah. So compared to the US and Canada's average household, our families are younger, lower income. Our households tend to have more members, right? And this is linked to the fact that we live in multi-generational homes. The abuelita lives with us, sometimes other family members. And it's more likely that we speak English as a second language, like myself. And it's more likely that there are members who do not have health insurance. And I think Wyandotte County is we're still struggling with that, still high rates of uninsurance among Latinx populations, in part because around 16% of the Latinx living in Wyandotte County are immigrants. And many of them are undocumented, like Erin and Alan mentioned before. So that is a barrier to get health insurance. Then our families also work in works that are essential. Like if you take a look at the numbers here, like service occupations, so that's your hotel, your restaurant, your gardening, your cleaning, high proportion there. Also natural resources, of course, construction, maintenance, high proportion. And then production, transportation, material moving occupations. So our community has been working the entire time. They haven't stopped. We can go to the next slide, please. So what leads to greater risk and what can be done? So increased exposure in the community. We know that because of housing segregation, it's hard to social distance. Early on in the pandemic, we got some phone calls from people saying like, my husband got COVID. We live in a 1-bedroom home and we share the same bathroom. Like, how do I isolate? And I remember a lady who was sick, her husband was healthy with her 2 kids, and they had to split the living room, and she will wake up at night, cook for them, and then isolate. It's just not possible, right? How do you isolate when you have not enough room in your house? Then multi-generational households, I already shared, it's hard to isolate. And when you have older people at home, it's the risk of complications is even higher. And transportation is also a barrier for many in our community, and they rely on bus transportation. So that's also elevated exposure. We already talked about the workers represented in essential industries. And this data is specific to African Americans, 12% of employed workers, but they also account for 30% of LPNs, MAs, CNAs. We see in both the African American and Latino population, public-facing service industry jobs, and especially in the Latino population, lack of paid sick leave, and that's directly related to the fact that there are undocumented individuals. When you look at Wyandotte County versus Johnson County, the number of people who have employed sponsored health insurance is way higher in Johnson County because the immigrants in Johnson County tend to be more skilled, and therefore they get jobs that have those benefits. And that's not the case for our people in Wyandotte County. And then we also know that there are higher rates of chronic disease in minorities, but this is also the result of systemic inequalities. And it should never be an excuse to say, well, they're just sicker, that's why they die, because that is not the case. If they are sicker, it's because of systemic inequalities that undermine the prevention efforts and in general increased levels of chronic and toxic stress. Next slide, please. So since day one, not because they're here, but I think Alan, Julian, and Erin have been doing an amazing job, doing all they can, working all the hours available in the day and night and weekends to be open to the community and accept feedback and tailor things and move things around to make things work. So since day one, the health department did a great job having information available in Spanish. And I know because we help with that at Juntos. So here, if you can see on the screen, I don't think my pointer works, but you have the food needs request and you also have the solicitud de alimentos. So people who are in need of food, they can go to that form, fill it out, and then somebody from the health department will contact them in Spanish to assess their needs and offer them help. There's also this tab for volunteers and donations. And here in the gray ones and the green ones, Pruebas COVID, that's also information about testing, where to get testing, how to get testing, what the criteria is, and all of that's in Spanish. And now this is more recent, cuando hacerse la prueba. So this is newer. Now the health department is offering testing for asymptomatic individuals as well. So this is information on explaining like who can have a test, right? Like asymptomatic individuals, people with symptoms, and then those that have been exposed, and then the time the best time to have the test done. Next slide, please. So earlier you saw some of the rates, the testing rates and the positive rates in the county. This is specifically for the pop-up testing. So that's something else that Alan and Eri and Julian were prompted to react to. They called community members, got feedback, and then got together a group called the Health Equity Task Force, which has leaders from different communities, not only the Latinx community, but the African American, the refugee communities. And the goal was to figure out what are the social determinants that are impacting these people, and they're having worse outcomes, and specifically around COVID, what can we do about that? How do we increase testing? How do we improve communications? All of that. So the idea of pop-up testing was to offer an alternative that wasn't necessarily something that Latinos identify as official or government, right? So instead of having to go to the unified government health department, you can go to your church, you can go to your community center. So the idea was to offer free, without requirement of health insurance, testing. Community-based locations where people could get easily places that they identify, partnering with trusted community partners. If you see here on the right, there is the October calendar. And 1, 2, 3, 4 sites are churches. Todos los Santos, Faith Deliverance, La Fe en Jesucristo, Oak Ridge. So these are 4 churches. And then the 5th one is a community clinic, Vibrant Health. So all those places are places where people feel trusted and connected because they're already part of that network. And then how do we identify the sites? How do we decide who to partner with? So what we do, there's a sub-testing committee that is part of the Health Equity Task Force. And we looked at those areas with the highest cases, right? And then we also think, okay, what are the neighborhoods where our minority community live? What are those partners that have the possibility to outreach the events, that are places that the community is familiar with? And that's how we identify the sites. So as today, we have tested around 4,000 individuals, and we have had over 100 events. And these events are staffed by the clinics, also with the health department support, and also with the support from many community-based organizations, including Juntos. I don't know if Ileana is here, but if you are, thank you for all your work. And what we have seen is 20% positive rate in the African American, 61% in Latinx communities, and overall 21%. So the rates are super high. Like sometimes it is surprising to see, you see the event and you see all your people coming, and then when you see the results, like people you knew that were there, and all of them are positive. It's just heartbreaking. Next one, please. So having the test where people know and in their community is not enough. We also have to do a lot of promotion, but we have been very fortunate to have amazing partners that have supported us promoting the testing events. For example, we have had Telemundo, Univision, 2+2, La Mega. All of these are Latinx-based media. That's what they do. They target Latinx. They have communications either bilingual or in Spanish, and they have done on-site coverage. You can see here Carla Garcia at one of the events, at the pop-up events. They have done plenty of interviews with us and flyers and social media to promote the event, and everything is either bilingual or in Spanish. Next one, please. I think it was late July or early August when we started seeing a spike, a very noticeable spike in positive cases in Latinos. So we kind of had to do something else to what we were doing. So I called really good friends at El Centro and United Care and Project Eagle and the Latino Health for All Coalition and others that work with Latino populations. And we just kind of got together to say, we need to figure this out. Like the positive rates are skyrocketing, and we're not getting the numbers of contact tracing that we should. So what's going on? And we got a lot of feedback. Lupita was part of those meetings too. And we got a lot of feedback from the community. So they told us, well, they're not going to cooperate with contact tracing as long as there are all these rumors in the community. There were rumors about if you get in the list for contact tracing, then ICE, immigration authorities, will have access to that database and they'll be able to locate you. There were other misinformations about the test itself, that it's harmful or you can actually get COVID by getting the test. There were other important gaps, for example, with employers. Some of them were not letting people go back to work unless they brought a letter documented their negative status, even though they had already spent 14 times back at their home. So we listened to what they had to say, and then again, started working with the health department, the community partners, and the media to disseminate the right information, reliable information. So you can see here in this newspaper information about contact tracing, because the whole thing was a new concept, right? What the hell is contact tracing? So they were able to clarify, explain. We also had the opportunity to explain. We got a lot of complaints from people saying, well, in this place, they're not wearing masks. What can I do? So guide them through the process to report those cases was one of the things that came out from that work group. Next, please. Erin or Alan, do you want to talk about the town hall?
Hey, Mariana. Yeah, sure. Well, you may know more about the town hall, but we did have a town hall in Spanish and English, which was absolutely wonderful. And as Mariana is referring to Guadalupe or Lupita, she also was very helpful in that. So this is just one more way that we're trying to get the word out about testing. And also there's just a lot of misinformation out there. You guys have probably thought a lot about this and heard a lot about this, but it's really very true. So unfortunately, you know, people really they really need, you know, expert guidance on you know, what to do and what it means to get tested and where they can go and how safe is it and that sort of thing. So the other thing is that we try to provide protections for workers and stuff. I think we get a lot of you know, a lot of questions about you know, for workers' rights, but also the businesses are wondering what they need to do when they get people back to work. Do they need to test negative before they go back to work? You know, what's the deal? So how do they safely, you know, find folks who have the virus and then let them stay home, and then how do you bring them back safely as well? Mariana, do you want to say anything else about it?
Yeah, so I think in the Latino community, there are a lot of small businesses, right? Sometimes they don't even belong to a chamber, or they do, but they not always have the information available in Spanish. We have a lot of Spanish-speaking successful business owners. So I think it was a great window that we open for communication. The employers are doing what they can, but they need to have the right information to do the right thing. So the idea of the town hall is to show them where the resources are, let them know that Haley at the health department is there to support. And I think this was the first one of probably more that we're gonna have, because this is an ongoing conversation. There was also an attorney available on that day, Bilingual, that he was able to clarify questions like human resources type questions that some employers had as well. And again, this was in partnership with many community organizations, so that made it a good first step. Next one, please. So I think this is the last slide before we open for questions. We've been fortunate to be able to work with this group, the Latinx Tailored Communications Group, the UG, and also ModUp. I don't know if they are online, but if they are, thank you for all your amazing work. Tailoring the information, right? It's not enough to have an overarching campaign. We need, in order to get to our populations, we need to talk to them in their language, in their culture. So now we have sub-campaigns that are targeting the Latino community, the African American community, and these are some of the materials that we have been developing and working on together, but it's really ModUp who do the magic happen. And so this salsa dancer says, si puedo bailar con estos tacones, cualquiera puede usar una máscara. If I can dance on these heels, anyone can wear a mask. I need all of this equipment to save lives. All you need is a mask. What's the big deal? Mask save lives. So this campaign is focused on mask wearing and safety behaviors. And Alexa, will you help us play the video? The black boxes. Yeah, thank you. It has sound. I don't know if it's. Huh. I wonder if there is if it's muted, the video. I don't know if it's possible to play with sound. I don't know if it's embedded. That there was an icon, sound icon. I don't know if it will work, but. Or Nelly saying something that you need to allow something. And maybe we can start with the questions and answer, and then if Alexa, if you can figure it out, we can watch it.
I may need to try playing it in a browser instead of from the PowerPoint. That might be the better option.
I think there's a request in the box here to place the link there, and then if folks want to go to it and watch later.
And, I think if we just cut and paste that link into the chat piece, that way folks can view it at their leisure.
Yeah, thank you. And thank you, Alexa, for your help.
Sure.
Okay.
All right, I think we can transition to the question section right now, and we'll just open it up for Mariana, Dr. Greiner, and Dr. Oh, I'm so sorry.
That's okay, Corvo.
Yeah, so we'll just open it up for questions now.
Dr. Corvo, I have a question. At the beginning of the presentation, you were talking about the community health workers. And I know from our work at sending students out to international locations, there's a lot more community health and community health workers involved in a lot of the international locations, like in India at CMC, in Kenya, almost all of our locations. So if you were talking to students or, impacting our medical education and our medical system, what would you say, or what would you do to help, make a change or to develop this more in our system?
So Kimberly, you're asking me, how would I do this? I'm sorry, I was trying to hear you. How would I implement that?
Yes.
Well, yeah, it's a really great question, and you're right. I mean, as you know, internationally, we can really take real excellent examples, I think, from other countries around the world, and one of the issues that we seem to consistently have in the United States is, I mean, I think there's this idea of everybody's got to be sort of credentialed and very, very highly educated in order to help with health in our community. And I think that what many other countries have figured out is that it's actually that when we have many in our community participating in the health of it, it becomes healthier. And so many of these folks are what we call lay health workers. They may not have PhDs or master's degrees or even have gone to college, but their expertise is in their knowledge of the community and the real underlying issues that affect people's health and well-being. And that's really very meaningful, because you guys will start to understand, the students on this, that as you get further and further into your education and into your sort of ivory tower, as we talk about it, it's really difficult, I think, to have the perspective, of the people that we serve. And so keeping a lifeline into the community is absolutely essential, I think, for doing this type of work. One of the other issues I want to mention is, I think that they're really hard. Our system does not fund community health workers adequately, and the continuation of funding for these folks is challenging. There have been some great models where some of our like managed care organizations and such have invested in community health workers, and also into case management and that sort of thing. But CHWs are special because they're out in the community on the ground working with people. They're not sitting in a cubicle with a telephone, and that's the big difference. So it has to be sort of a continued investment and acceptance, I think, of these professionals as part of our organizations and the overall way we do business. Of course, we haven't been very prevention minded. It's going to be very interesting, I think, after this pandemic, to see, do we learn from this as a nation? Do we learn that funding public health and community health is actually a really strong investment? I'm happy to hear if Alan or Mariana or others have more ideas.
No, I think that's really good. I think I have this one slide I use in some other talks that shows how much the United States spends on the total of healthcare expenditures plus social services. And of course, we spend much more on healthcare services than any other country in the world. But we're somewhere in the middle of the top 40 industrialized countries in terms of that total spend. But our social service spend is tiny compared to all these other places, right? That all have better health outcomes than we do. And we've only recently, I think, widely acknowledged that the social determinants of health are the reason for these poor health outcomes. And unless we do more in the social service realm, such as, and community health workers aren't directly social service, but to me it's related, right? Until we start spending that money, we're probably not going to narrow those gaps with those other countries. And it's all tied to systemic racism and racial inequality as well, right? The populations that have the most problems with social determinants of health are the ones that have been historically discriminated against and continue to be. So we got a lot of work to do.
I posted a question on the chat, but I was wondering, as you were presenting some of the initial data, why some of the data is not available for Johnson County for Latinos, since it's the second largest county with Latino population presented. It's because it's not available, or what's going on?
Yeah, are we off mute?
Yeah.
There's been a lot of variation in how people are able to collect data and how they're calculating things. I think one of the ones where we didn't have anything was on hospitalizations. Johnson County has a couple of hospitals in the county that have just refused to report their COVID data at all. And at one point we thought we were going to be getting that data, and then the federal government changed the rules. So it's been really frustrating trying to get consistency from county to county or state to state even on some of these data items. And it's too bad, because the data is really important to making policy decisions when we're having to make decisions so quickly. Some of you may know that early on in the pandemic, way back in March, there really wasn't much effort in a lot of states to collect race and ethnicity data on cases. And we were lucky here in that we had a good team, and we kind of noticed, hey, wait a minute, we gotta collect this. And we actually had to backtrack the first 10 days or something of the pandemic and go get that data, because we didn't want to not know what was going on with the Latinx community or our African American community. And so we've been pretty successful here in obtaining the data, but it's only because we pushed for it, because there's no good systems in place to set this up. And it's a good example where when you don't have good centralized decision making, you've got problems. And so you've all heard about this as the pandemic's unfolded.
Yeah. But it's a good point, because so up to this point in the Wyandotte County Health Department, for other disease investigations, we have not reported race and ethnicity data. Those data just have not been collected. And I mean, that's, to me, it's just like blows my mind that it had occurred up to this point for so many years. And now that's been changed. Unfortunately, maybe happily, we don't have Johnson County under our jurisdiction. It's so many people there, but it's a different county, and things are done differently there, I suppose. Although there's a lot of good information on their hub at the health department site. It's been getting better and better, so.
I've got a question. How has the cases number of positives trended as some of these initiatives have been rolled out by WyCo?
That's a really good question.
Good question.
I think, a couple highlights that you can clearly see in our county data, that the stay-at-home order way back in April made an impact. You know, we had a real drop in daily average cases at that time. And then it after that changed, right, and people were back out in public, it started climbing back up again. And then we passed the mask ordinance. Now, we didn't get as dramatic of a drop, but we came down off of that peak in July and have had pretty steady numbers, maybe a little bit of decline over the past 2 months. But I think the big interventions that we clearly know work are, you know, social distancing, staying away from people, which is what stay at home was all about, and mandated mask use whenever you're around other people. And so it's frustrating for us when people talk about, it's just inevitable that we'll have lots of infections and we're just going to have to live with that, yada, yada. We know what works, and it's not like it's a heart transplant. It doesn't really cost that much to mandate that everybody wear a mask. And I think you're going to see, I think we're going to work on emphasizing that in the coming months because it's going to get colder. And I think you're going to see others do that. It's an intervention that works, and we know that we've got to push it. Now, the testing and the contact tracing, it's been a little harder to see its impact, because when we had all those cases in July, we got really behind on our contact tracing, and really everybody did in the Kansas City metro area. So it kind of remains to be seen whether really intense contact tracing can have a big impact. It might not have as much of an impact. We still think it's important, so we're still pushing for it and finally getting caught up. But hopefully there'll be even more interventions, right? Next we need a vaccine, but that's a talk for another day.
Can I follow up with another question?
Sure.
Having looked at these cases and dealt with coronavirus in Wyandotte County, how much of an influence do you feel like Jackson County has on the Wyandotte County caseload?
Probably quite a bit. We know historically that there's lots of individuals who, for example, have family members that live in Kansas City, Missouri, or Jackson County, and there's lots of back and forth interaction. And so it's very hard to do anything in a vacuum here in the Kansas City metro area. It's probably true of Johnson County to some extent too. So, and even outerlying counties. So there's lots of need for coordination. We've been trying our darndest to do that. We've got multiple meetings a week with other local health departments, with other governance structures in the other counties, but it's still been hard because the pressures are a little bit different, and the way decisions get made are a little bit different in different counties. But definitely this pandemic just shows you no one lives on an island. All of us are part of a sort of interconnected web of health, and we need to think that way. We can't just think that it's about individual decision making or responsibility. Everybody's connected to everybody else.
So I know that we've been talking about Wyandotte, but do we know what the impact of COVID is being in Southwest Kansas to Latinos?
Yeah, there's thanks. That's a great question. There's
a good question.
There were some really large outbreaks in April, May, and early June in Southwest Kansas, and numbers were really, really high there for about 6 weeks, but they've declined quite a bit. Now, we don't know if some of that decline is related to lack of interest in testing, because I do think we've certainly seen that around here, that some of the community, has been less interested in testing in recent months. And some of that probably has to do with the things Mariana talked about, with the misconceptions or myths or the suspicions. We actually are trying to get our hands on a grant so that we can do some work with some of the counties down in Southwest Kansas on testing, new and different testing strategies. Since we have done so much of the pop-up testing stuff, we're hoping that we can get some money to work with them and provide technical assistance, plus provide them some chunks of money to do some of their own things like that, where they can really outreach to the Latinx population, because as you know, many of those counties are 60 or even 65% Latino now. So it's really changed over the last generation down there, and those communities really need people interfacing with them. We worry about the way some of the employers, deal with things down there and whether the environments for work are safe. So we've actually been talking to the health departments and health officers down there about that, and probably we'll be talking to them more if we get this grant. Hopefully we do.
Yeah, we have our health officers trauma support group once a week. We laugh about it, but it's actually been really difficult because I think politically, unfortunately, some of the health officers, especially in the rural parts of the state, are suffering with just people do not want to comply, and they're very angry right now. And as our nation is very politically split, so it goes, during the pandemic as well. But I think that's a really good question, though. There's also some very rich community health worker networks, promotoras networks out in the more rural parts of the state and such. So, yeah. Thank you.
And to complement Jaime, besides the testing and the positive cases issue, we also the social needs, incredible needs for food and other services down there, and the capacity wasn't enough to help. It seems now things are improved, but again, we don't know if it's just the lack of people going to get tested, or it's in fact getting better.
So can I ask one question, Mariana? Do we still have time?
I think so, but David or Kyle will be, or Kim, they'll be.
Yeah, I think we've got time for one more question. Go ahead, Eric.
Yeah.
Okay, just the data that you present in the beginning of the presentation showing that 16% of people that were tested were Latinx. Does this data include the pop-up test or? Yeah, okay.
All the tests in the county.
Yep.
Mm-hmm.
Is that the demographic that's least tested, would you say? Like looking across all those, would you say that's the least tested group?
No, I think actually the uptick of testing in the Latino community has been very good. So that's a good thing. And it's somewhat consistent with other literature and science. Mariana may be able to speak to this as well. But for example, in the world of immunizations, we tend to get really good uptake of immunizations in Latinos, which is a great thing. We would be having even more problems with health inequities if folks weren't willing to come out and get tested. But we do worry that some of that uptake has waned and we won't be able to sustain it, and we really want to sustain it and have enough of those services, the wraparound social services that Mariana mentioned, to sort of stimulate and incentivize people being involved with public health.
Yeah, so we actually can use all of you guys' help to share this within your networks. We need people to come get tested. There's no other way to prevent the dissemination of the infection. We need your brains to come up with strategies to implement these wraparound services, right? People are not gonna come if they are gonna be told they can no longer work, and then their friends can no longer work, and then have no income for 2 weeks. So as a community, we invite you to help us figure things out. And yes, Kyle, at the pop-up testing sites, we have a large participation of Latinos, irrespective of the site. Like there are some sites that aren't necessarily in Latino neighborhoods, and we still have Latinos coming.
Mariana, can you tell us what else to expect this month with Hispanic Latinx Heritage Month?
Yeah, thank you, Kim. And fortunately, we have many members of the planning committee here. I see Erica, Juliana, Jaime, and I know there are more. It is Letty. I think we have a film coming up with Dr. Falikov. She's gonna be, we're gonna be showing the Black in Latin America documentary, and then she's gonna facilitate a discussion on it. I highly recommend it. Please put it on your schedule if it's not there already. And then please help me guys if I'm missing something. On October 14, we have the research day. It's going to be an amazing morning with different research, community service and education projects from 10 to 1. Diana, Jaime, Brenda, Erica, they're leading that. And then we have our keynote speaker that Juliana and Ileana got for us this year is Dr. Perez Estable, of course, with the support of Kim and Dean Oja. So Dr. Perez Estable is the director of the Office of Minority Health, and he's going to be the keynote at 1. And then in the afternoon, we have a roundtable discussion about our African roots in the Latino culture. So if I miss something, please jump in.
I think we have one more community conversation. Is it October 6th, a panel discussion about, okay, go ahead, Erica, sorry.
Oh no, I was just about to confirm that it's going to be on October 6th from 12 to 12:45. Yeah, our community conversation about the microaggression. Yeah, the title is, but really, where are you from? Unconscious bias and the microaggression in academia and healthcare.
Okay, well, we're at the 1 o'clock hour, so I want to make sure all of you can get to your 1 o'clock meetings if you have them. But I just want to thank everyone for coming today and attending this. If there are no more questions, and to thank our 3 phenomenal presenters, and to stay up to date on the continuing events we have for the rest of Hispanic Latino Heritage Month.
Thank you.
Thank you, David. Thank you, Kyle. Great job.
Thank you, guys.
Hey, Alexa. I think I may have found a solution to the sound in the PowerPoint. I will forward you that link that I found. I think it's a setting within the PowerPoint presentation itself where you have to check and make sure the sound is up. I didn't know about it either, so. You're on mute. I can't hear you.
I don't know if the issue was PowerPoint, my computer, or Zoom.
We're still recording, by the way.